Okay, so the common cold symptoms are runny nose, sneezing, congestion, cough, and those symptoms might last up to 10 days. So those are the more common symptoms on a children. As much as we decide, there's really not a treatment for common colds that can rid off of the infection per se. All what we do is just treat the symptoms. There's so many preparations over the counter that are recommended for the symptoms, but we have to be very careful because those preparations are not recommended for kids younger than 6 years of age. Those kids can get overdose easily, can have serious side effects of the preparations, and also dead. Therefore, it is important that you always talk to your doctor about what is good for your young kid at home. There's some preparations that help with the congestion and then with the runny nose and all the difficulty breathing. I prefer to use preparations that does not have or does not contain any fever relief products like acetaminophen or ibuprofen. It is always important to monitor the fever separate from those symptoms because the fever can tell us if the patient is having a complication from the cold like a ear infection or pneumonia. Sometimes do less is better than doing too much when we have a kid with cold, and some simple complementary medicine it might help like honey. The honey has shown that it helps better than some products over the counter to control the cough and sore throat in little kids. If your kid is older than a year of age, you can give 1 teaspoon of honey and it's going to relieve the sore throat or the cough that is presented. Also, make sure that the level of hydration that your kid has is really good. The appetite is going to be down for a couple of days, so it's not much important if the kid is eating, but the kids should be drinking plenty of fluids. Humidifier is helpful. It makes the kids sleep comfortable at night, and also the use of some essential oils like eucalyptus help with the nasal congestion and it helps them sleep better. And all of those are natural medicines that you can do anytime and you're not going to be overdosing or have the fear that your kid is going to have a reaction. It is important, in a cold in a kid, it might last up to 10 days, and then after the 10 days, the symptoms start to be less and less. Completely different than what happens in an adult, that is, it lasts about 5 to 7 days. That's the reason why so many parents come to the office thinking, oh my gosh, the cold is not getting better, or the cold is getting worse because my kid has been sick for so long, but that is not true. What we need to pay attention is in the fever that the kid is having. Like I said, a cold might give you fever, but it should be for about 2 or 3 days. After that, it should start going away, and all what the kid is going to have is the congestion, the cough, and the runny nose. And the symptoms should be less and less and less. If the kid persists with fever or difficulty breathing, or in kids, it's very easy to see the level of energy. So if we have a kid that is laying on the couch, no wanted to move around, don't wanted to play with the kitchen pots or anything like that, then that is a kid that is sick, despite of whatever other symptom kid is having. So I would suggest that after 5 days, the kid is not recovering, continue having fever, please call your doctor and have the kid observed by your pediatrician and see if there's anything else like ear infection, pneumonia, which are the most common complications of colds. The best way to prevent colds is hand washing. Hand washing, soap and water is the best way to prevent that. The alcohol-based hand sanitizers has shown that they are not kill the viruses that we carry at home and also in our school. So because so many of those viruses can be already resistant to the alcohol-based hand sanitizer. But the best thing is hand washing, hand washing. They say that there's nothing more dirtier than the hands of a child, but that's what is important, that as a parent, you be aware of it all the time, that you go out to a place or so. Whenever the kid walk inside the house, if you have a rule like take the shoes off, they have the rule of go straight to the bathroom and wash your hands. It's really important, and you just have to enforce that, because the kids are not going to want it to do it. That's your role as a parent to teach that. Colds are really common in children, and children younger than 6 years of age can have colds every 2 weeks during fall and winter time. So it is important to control the symptoms, observe the symptoms after a period of time, and not necessarily to panic about those symptoms. And again, if the symptoms persist, please call your pediatrician and have your kid observed by the pediatrician.